It's Dr. James from Vets of Geelong, and today I'm talking about kidney disease and specifically how senior pets with kidney disease present to us in the consult room. Typically, kidney disease is, a problem associated with older patients, and typically they present to us once their kidneys, of which they typically have two of them, get to a point that they've lost some function in them. And once they get to below 30%, 25%, 20%, these patients start to present to us with issues. Typically, owners might notice subtle changes at home, and they're just a bit off colour, vomiting, nauseous. Also, they often just keep drinking. And owners they walk back and forth to the water bowl, drinking. And sometimes that's all it is. They're otherwise happy and healthy. What you tend to find, it's the body's way of compensating to flush out those toxins, the urea and creatinine building up. They're feeling a bit lethargic, nauseous, and their body's just wanting to drink more, and therefore they're urinating more. Particularly with senior dogs, if they're outside, you may not see the increase in urine, but you might see them drinking more. You might see them going out through the doggy door a bit more, and those subtle things. What we tend to find clinically when we examine them, they might be bright, they might be well. They can have ulcers in their mouth, they can have a really foul uremic smelling breath as well. They may have lost muscle tone, but it can be anything in between depending on how severe that kidney disease or renal disease is. Often what's happening then at that point when we examine them, we'll recommend some blood tests, and we're checking specifically kidney markers and a few other markers as well to make sure they're otherwise okay. There may be circumstances where we'll do a follow-up urine sample again to see how the kidneys are concentrating. Sometimes we'll do an ultrasound to look for other issues as well. But essentially, blood tests, urine sample, and ultrasound are typically the main way we start to, diagnose or manage patients with renal disease. What you might find then, once we get a diagnosis, what we're trying to do is preserve that kidney function that's left. So there is certain medication, whether that be ACE inhibitors, phosphate binders and the like, to again slow down the damage to the kidneys. We might recommend a specific diet or a renal friendly diet, again to slow down the damage to the kidneys and just decrease the kidney's ability to work so hard. But ultimately, if we can act on it early, it increases the longevity of the patient, and ultimately if they're a bit happier, less nauseous, and drinking a bit less, they'll go on to live reasonably happy lives. But what you will find is we will be seeing a bit more regularly, doing blood tests, checking parameters, being very mindful of certain medications, so arthritis medication, being more cautious when they're in for their anaesthetics and the like. But this is how we have to deal with their medical problem. But if you've got any questions, you've got a dog with kidney issues, reach out. The team are more than happy to chat and talk you through what options we've got to help your little patient. All the best.